Good afternoon, Missoula County. Today is June 9th. You're hearing from me again, Ken Parks, this week's incident commander for our county's COVID-19 response team. First, I'll review local and state case counts. Then I'll share some information related to a positive case that we announced in late May. And I'll finish up with some information related to broadening our testing criteria across the county. We've had a total of 41 cumulative positive cases to date in Missoula. 39 of those cases were identified by testing, and 2 were epi-linked. We have had 40 recoveries and 1 death, and we have no active cases in isolation currently. The state has had a total of 554 cases, including 6 new cases confirmed this morning. New cases today are reported in Gallatin and Bighorn counties, and the state is reporting 51 active cases. Now, about that case from late May, I'd like to address COVID numbers in Missoula County, since you will see a change reflected in our county website today and a change to the state website tomorrow morning. We first reported a positive test and an active case, 1 person, on Friday, May 29th. At that time, Missoula County had been without an active case for nearly 2 incubation periods, or about 28 days. Preliminary investigation indicated that the positive case was likely due to community spread, which was what we communicated in our daily briefing at the time. Following the initial test and our initial report, Montana State DPHHS elected to conduct a second set of COVID testing on the same individual. This subsequent testing of the same person yielded a negative result, indicating that the first test was a false positive. DPHHS notified Missoula County about this information this morning, and we continue sharing information in real time as it becomes available. Please note that the case counts on our county websites, as well as state DPHHS website, will be updated today and tomorrow to reflect this false positive in Missoula County. Given this new information, we can state that there's not been a positive case in our county for more than 4 weeks. Our current numbers reflect this new information about this false positive, which is why you will see a reduction in our cumulative positive cases, which are now 41, our cumulative positive tests, which are now 39, and our recoveries, which is now 40. Now I'd like to share some information related to testing and broadening our testing criteria across Missoula County. We've already seen media outlets sharing information about this broader testing this morning, and we'd like to provide as much information as possible to help community members understand what this process looks like and what the public can expect moving forward. The state designated Missoula County as one of 20 high visitation communities across Montana. This designation comes with additional resources for community testing and contact tracing. As with previous directives, the state granted local authorities the ability to determine the best way to expand testing locally in direct response to local level needs. The health department continues collaborating with partners across the community, including the University of Montana, clinics, hospitals, and medical professionals, to determine the best way to develop, implement, and evaluate broader systematic testing, which will include testing asymptomatic individuals. Asymptomatic testing, or testing folks not currently experiencing COVID-19 related symptoms, is one component of a larger surveillance or early warning testing system. While broadening the testing criteria means that more people will be able to seek testing, these resources will continue to be prioritized and used based upon county needs. To this end, certain frontline workers who have high levels of engagement with the public, think first responders, grocery checkers, and the like, will receive priority testing, given their significant level of ongoing risk and exposure. We continue sharing information in real time as it becomes available. A testing plan is in draft form right now. Once completed, it will be sent to state DPHHS for review and approval. This approved testing plan will be released to the public Thursday, June 18th. In the in-between time, the county continues offering free testing at the fairgrounds for county residents currently experiencing symptoms or county residents caring for someone experiencing symptoms. Testing also remains available for frontline workers experiencing symptoms. Clinics across Missoula County continue providing testing services as well. You can call us at 258-INFO to connect with our public health information line Monday through Friday from 8 a.m. to 5 p.m. Additionally, we continue updating our county website to reflect the most recent, accurate information. And you can continue connecting with us on social media. Thank you. Be well and take care.